Yeah, thanks everyone. Yeah, I'm Stephen Neas. I'm a GP at the Tuna Medical Centre, which is just up the road, and I've been there for about 18 years, and I work there with my wife, and I'm also been on the executive of the Cancer Society for a good 10 years as well. So men's health is important, and it's important because men's health is worse than women. Men don't live as long as women. The life expectancy of a man is about 4 years less than a woman. Men consult their GPs, I think, 4 times less than women. And I was reading something yesterday which said that 50% of men will only go and see a doctor if they're compelled to by their wife or partner. Yeah, so I think men's health is a big area. When I think of men's health initially, I think of the nuts and bolts. I think of testicles and testicular cancer. I think of erections. I think of prostate cancer, and other people will be covering that this evening. So what I want to talk about is a few other things. I want to talk about cardiovascular disease. I want to talk about bowel cancer, and I want to talk about depression. But I mean, there's lots of other things you can talk about. And I guess my key messages are that it is good to come and get a checkup, and I'm not really touting for business, but I think it's also important to know why you're coming in, and it's good to know what you're expecting your GP to do. The second thing, I think it's also really important not just to come in for a checkup, but to actually know when there's a problem, and so to come in early. And I think one of the real issues with men's health is that we can notice a change in our health, notice a problem, and then think, oh, she'll be okay. I'll leave it and see what happens. And I'm actually a good example. A personal experience like this week. 3 days ago, I noticed this red mark on my arm while I was swimming. I thought, oh God, it looks like a bit of a skin infection. Probably should start some antibiotics or see my GP. And I thought, oh no, I'll see how it goes. And today I was working and thinking, man, I'm really feeling terrible. I feel a bit feverish and I've got this terrible headache. And I feel just lousy. I must be really nervous about speaking tonight, And then I was at the gym just a couple of hours ago, cycling away and looking at my arm thinking, oh man, I'm feeling terrible, I've got this terrible headache. And I suddenly realised, oh, I've got a skin infection or a cellulitis and I need to see a doctor and start some antibiotics. So I kind of did it a couple of hours ago, and I'm actually feeling a bit better now. Yes, so if you notice a change, get things checked immediately. So starting off with kind of what's called cardiovascular disease. Cardiovascular disease is heart attacks and strokes. And the reason why they're important is that they are the number one killer of men. That's the leading cause of death in men. And 1 in 5 men, this is what I read yesterday, 1 in 5 men will die prematurely before the age of 75 from a heart attack or a stroke. So what are heart attacks and strokes? So heart attacks and strokes are when the arteries that supply your heart or supply the brain get narrowed, and then in a certain instance can close off and cause death of either part of your brain or a part of the heart muscle. I guess there are some well-known risk factors for cardiovascular disease, and they are smoking, high blood pressure, diabetes, family history. I need to look at my notes. Yeah, smoking, high blood pressure, high cholesterol, of course, diabetes and family history. And that's kind of why men, when they're 45 or 35 in certain instances, will get letters from our practice nurse saying, come in for a checkup. Get your cholesterol checked, get a diabetes checked, then come and make an appointment. We'll check your blood pressure and we'll work out your cardiovascular risk. And what we're doing there is trying to identify people who are at high risk of having a heart attack, because we know that if we intervene early by lowering your cholesterol or your blood pressure or thinning your blood, we can reduce your risk of having a heart attack. And that's kind of a big, it's a very, very important part of kind of what we do as GPs. So you've got your prevention on one hand. I think the other key thing though about heart disease is that no matter how fit you are, No matter how good your cholesterol is, no matter if you look after yourself well and exercise and you're thin and you don't smoke and all those things, just being a man and being in your 40s, 50s or 60s gives you a risk of having a heart attack. So I think one of the key messages is to really, know what heart pain is and come in early. And just in my own practice, I've seen guys who are perhaps a man who was 40, fit as a buck rat, he'd just done the Rainbow Rage, and he kind of came in with angina. And I was like, God, you're fitter than me, how the hell can you get heart disease? So, what is angina? So our heart is So angina is when the arteries around the heart get narrowed, and so our heart is a muscle which pumps blood around our body. And if those arteries or those fuel lines are blocked, we are often fine when we're sitting doing nothing, a bit like a car that's idling. But when we, put the accelerator to the floor and try and speed up, then we start to have problems. And what you notice is chest tightness, chest pain or chest heaviness that's often quite hard to localise. You can't say, I've got a pain here or here. It just feels like often an elephant or someone sitting on your chest. The pain can often spread into your arm or in your jaw, and you can often feel short of breath as well. So I think a key message for any man is that if you notice any chest tightness or any breathlessness when you exert yourself, you need to get that checked out, pronto. And that's really a red flag to come in. And it's a bit like, if you've seen your GP last week and he ticks the box and says, you're fine, Stephen, go off and enjoy yourself, and the next week you notice something like that, you shouldn't say, oh, look, I saw my GP, things are okay, I'll just wait and see. You really should be coming back immediately to your GP. I mean, the treatment of heart disease these days is really good. Nelson probably has we've got a Rolls Royce really kind of cardiology department where we've got, they do stents and angiograms and stuff like that. So it's a fantastic service. Yeah, so that's heart disease. See your doctor. Get in early if you've got pain with exertion. The next one I wanted to talk about was bowel cancer, and I think the reason why I picked bowel cancer is it's the second most common cancer in men after prostate. Is it, Andy? Yep. So prostate's number one, but bowel cancer's number two. But bowel cancer kills more men than prostate cancer. So bowel cancer is the second most common cause of cancer death after lung cancer. And I guess the key message again with bowel cancer is that if you notice a change, then you need to get things checked out. And for bowel cancer, the change that men can notice is a change in their bowel motions. So they're either perhaps going to the toilet more often and their bowels are looser, their poos are runny, or they perhaps feel as if they can't empty properly, or they get constipated. And I think if you notice that and it's going on for more than 4 weeks, you should come in and get checked out. One of the other symptoms of bowel cancer can be bleeding. And again, that means, if you have bleeding, it's very easy to put it down to piles or something like that, but it really is important to get that checked out. And I think on a personal note, my father died of bowel cancer at the age of 65. And when he got diagnosed, his cancer had spread to his liver. And at that time, they didn't use chemotherapy. And so, he died quite quickly. But before he got diagnosed, he probably had 2 years when his piles were playing up. And, he talked with my mother, who was a nurse. He probably said it was his piles, but still he didn't go and get it checked out. Yeah, so the other thing with bowel cancer is that bowel cancer is one of those cancers that can have a genetic basis. So if there is a family history of bowel cancer, and in particular brothers, sisters or parents who get bowel cancer, especially at an early age, then it is really good to get that checked. The way of getting it checked is by having either a colonoscopy, which is a telescopic examination of your bowel, or you can do a CT scan of your bowel, which is called a CT colonography. And the private X-ray, Nelson Radiology, kind of advertise that quite heavily in the Nelson Mail and stuff like that. They're not, I think a CT colonography is about $700, but it's not cheap. It's quite hard to get colonoscopies, telescopic examinations of your bowel through the public hospital system at the moment. There's a long waiting list, and they only do the most urgent. And I think the waiting list can be up to 12 months in the Nelson Hospital. Right, yes. So moving on. Depression. Yeah, so 1 in 10 men will become depressed during their lifetime. And I think depression is often under-recognised in men, mainly because we don't go and see our GP and perhaps don't like to talk about things. Men have a higher suicide rate than women, and often we can self-medicate, treat the symptoms with perhaps drinking a bit more alcohol or something like that. What I wanted to say around depression was really, what are the warning signs, what are the main symptoms of depression, when should I go and get them checked out? And the two main features of depression are feeling down, depressed or hopeless, or losing your interest and enjoyment of life, losing your pleasure in life. To make a diagnosis of depression, you have one of those two things. And it's, we all can feel down at times. Depression is when you persistently feel down for longer than 2 weeks. People who are depressed, can also feel tired. They may not sleep well. They may lose their appetite. They may feel bad about themselves. They may have negative thoughts. They may have kind of suicidal ideas. But those two hallmarks, down, depressed, hopeless, feeling down, depressed, hopeless, and losing your interest and pleasure or enjoyment of life. And so I think if you notice that, then it is a good thing to go along and have a talk with someone, either a GP or a counsellor or something like that. Treatment of depression, there's kind of a couple of aspects to the treatment of depression. There's medication, antidepressant tablets. Counselling is equally as effective. And then there are lifestyle measures, which is really looking at getting some regular exercise, looking at your diet, making sure you're sleeping well, planning your day, because when you're depressed, you often kind of lose your get up and go. You can often sit there and do nothing. So that's depression. How am I going for time? 3 more minutes. Okay, wow. Okay, skin cancer. No one else. So skin cancer is important. I think, and again, it's one of those things, I think Al talked about mole maps. Mole maps are good. You can either, of course you can come and see your GP as well, but, so we do, GPs, we often do skin checks. We have dermatoscopes, which are magnified light machine that we look at moles. And, I think it is part of a health check would be having a skin check. One of the main risk factors for skin cancers is sun exposure, and that's why there's a lot of stuff that the Cancer Society do around the prevention of skin cancer. So putting on sunscreen, covering up, wearing a hat, and keeping out of the sun. That's right, isn't it, Linda? Yeah, good. And so just to finish up, so hopefully there's some reasons to come and see a GP. So when you're seeing your GP, we should be checking your blood pressure and looking at your cardiovascular risk. We should be checking your blood pressure and your cholesterol and doing a diabetes check. We should be asking if you're getting, chest pains or there's a change in your bowel habit. We should be having a look at your skin. We should be talking about your family history. Yeah, so that's all I've got to say. Thanks very much.